Not good jump with me. Streptococcal A group, that infection. Acute or chronic tonsillitis most commonly. In most, but how long this disease? 1-2 weeks usually, right? If patient had 7-10 days oral or infectious antibiotics against penicillin group, Neol, macrolides, cephalosporins, first generation and second, cefazolin, cefuroxime. Disease not developed. Here finish will be. I missed and genetical mimicry or young or children. Next stage will be latency. What do you mean latency period? No clinical picture. But это not good job. 2-4 weeks. For this weeks, immune response gradually producing antibodies, anti-streptomycin, and some other. ASLO, anti-streptovirus. And when they will be higher than some individual borderline. Next stage will be, what next stage? It will be another good job. Maybe this good. Acute rheumatic fever, when it develops, in 2-4 weeks after recover from first hyperemia, plaques, past plaques may be in lacuna. What fever may be here, 7-10 days or 2 weeks more. With treatment, shortly, without treatment, like recover. In 2-4 weeks afterwards, anyway, acute rheumatic fever develops. This disease has stages. Acute rheumatic fever. Why include specific main manifestations? They say like main clinical criteria of joints and non-specific minor criteria, minor manifestations. Yeah. What? Алло, профессор. Добрый день. Здравствуйте. Вы профессор Поспалов will be your teacher on 5th-6th year. What? Major manifestation or major criteria? Clinical manifestation and minor non-specific. What non-specific? Fever starts. First symptom will be fever, and fever without treatment, anti-inflammatory, non-steroidal. Historically, of some tree they contain. From 19th century, sodium salicylate or acetylsalicylic acid, large dose, very good control, but control only human joint, no control heart environment. Few tubules all like mist, but disease in connective tissue has not controlled. No, and arthralgia maybe. Arthralgia. Do you mean term arthralgia?
Pain in joints.
Joint pain. What is the minor? What? Major.
Carditis.
Major. First, major. Will be first migrating polyarthritis. It appears directly with you and you will detect migrating polyarthritis. It's from what? First days we start to review. Suddenly, it's acute arthritis, reversible, benign, swelling large joints, symmetrically, elbow, brachial, popliteal, femoral, maybe what, antebrachial joints, and tibia. 1-2 pairs of joints, swelling, hyperemia, hot, restriction of mobility, but few tablets of aspirin, and in few hours all controlled. And patient, absence of swelling, good mobility, only arthralgia maybe some, cold, wet weather. Это polyarthritis benign. Second, but most important, because irreversible maybe. What do you say? Rheumatic carditis. Carditis, inflammation of heart. What most important? Myocarditis. At all, 100%. But migrated polyarthritis, это не 89% of patients. Endocarditis. Endocarditis, especially mitral valve. Mitral, especially. Near 60%. And maybe pericard, dry or effusive. Это rarely. 5-10%. Here, clinical symptoms develop gradually during 1-2 weeks, if no appropriate treatment. What? Tachycardia. Some dilatation has borders. Murmur appear on mitral valve in a few days or 1 week. Murmur of regurgitation, because dilatation not complete close, the systolic murmur it takes that can transfer ciliary space, especially in horizontal part, and in horizontal restore to the left. Heart sounds decreased in volume. Blood pressure, systolic lowering maybe, pulse maybe. Accuracy noise can appear. Nose, chin, lips, ears, peripheral parts of extremities. Congestion, because many affection, mitral valves, left Congestion and pulmonary circulation. That's why accented second sound on pulmonary. And maybe increased blood feeding pulmonary. And if severe congestion, crackles, fine crackles create, host crackles, wet small, in inferior part of muscle. This, cough sometimes, cough. Вот. When endocarditis develop and no appropriate treatment, not only dilatation, failure, adhesions can develop. More rigid. Murmur can in 1-2 days become more loudly. More irritation to the lips. Appearance of prominent murmur on necks. Not so frequent in the water. Shows that endocarditis develops. If dry pericarditis, systole diastole pleural rap, in absolute handalis area, 1% space. Near xiphoid, not conducted. Pain, long. Control only by analgesics, not steroidal, maybe. Pain less and leaning forward. And if endocarditis with effusion, heart sounds becomes muffled, non-clear, small sound. Pleural pericardial rap missed, pain missed, but dilatation of absolute and relative heart dullness. Triangle heart configuration, wide transverse size of heart. In severe cases, maybe что? Pressure on veins, dilatation this veins. Jugular veins. Very decreased cardiac pulse. It shows the patient needs an puncture. Puncture under the control. X-ray, ultrasound do not affect myocardium. Puncture usually what? In 4/5 interspace. Near left atrial or endoxiphoid. Carditis. What if carditis? Treatment missed, это minimally 1 month anti-inflammatory non-steroidal plus anti-streptococcal antibiotics up to 1 month. What maybe? Swelling 1-2 weeks. Mucosis, reversible. Pathology anatomy, histology. Трансфер их, что? Formation granulomas. Вот. In myocardium, in castle walls. And next, fibrosis and cicatrization. То есть, if first 1-2 weeks misdiagnosed, we think about arthritis and miss heart problems. Irreversible changes and chronic heart rheumatic disease that will be all future with cardiosclerosis, myocardial and cicatrization cast wall result in failure, mitral aorta. Sometimes opposite, very sick with adhesions, rigid, sclerotic, stenosis, plus changes in intracardiac square result in dilatation, left ventricle, left atrium wider. What? Heart failure, many with congestion and pulmonary circulation. То есть их overload risk of pulmonary edema, risk of repeated congested pneumonia developed sclerosis, and risk of arrhythmia and heart blocks. No, and other specific, not so frequent. What may be?
Subcutaneous nodules and erythema.
What? Erythema нодуляре, аннуляре, rheumatic erythema. Erythema аннуляре. Аннуляре это ring-like, very small red spot on upper shoulder girdle, anterior posteriorly. On this and this upper part of it. And next it increased by the center pale place, maybe light itching, reversible. Это specific but rare problem. Maybe in few weeks sometimes, not in months after pasteuritis. What other?
Subcutaneous
Rheumatic nodules. Same. Rheumatic nodules. Это тоже 10%. Это on external surface large joints and tendons to them. Formation subcu, movable, dense elastic 1-2 centimeters nodes. Это rheumatic granulomas. But they reversible during 1-2 months. No, and central nervous system affection.
chorea.
Chorea. What? Это CH. Chorea. Это from Old Greek what? Horus. You know Horus? Why you don't know Horus? Horus in Old Greek. Это инсета. Вот, антистусин, там, инрос, они вот, group who singer and dancer. They sing and dance. And now you can read chorus, no, mainly dancer. In some European countries, like in Belarus and Russia, chor from это musical group of singers. And some countries mainly about dancer. What you may be dancer. Could be Sri Lanka dancer, very good. Every year I see a concert in university. What? Do you know what is the chorea can develop from 1 to 6 months after tonsillitis. Sometimes arthritis, missed, heart problems maybe, and what? Patient missed what? Это usually in children. They have because disorders in central nervous system. With involvement cerebral vessels inflammation, disorders in structures of cortical centers that control muscle tonicity, coordinate what may, on face maybe involuntary grimaces. Teacher can send the student, no, young student, not 10, 20, not serious. Additionally, muscle weakness, they like very late, but involuntary convulsions asymmetrical, maybe another skeletal. It's like strange dance. What like Sri Lanka dance or other. Strange dance. Headache. This problem reversible. Only reversible. What? You missed 1, 2 first week with problem, myocarditis and endocarditis that result in chronic rheumatic heart disease with grave developed heart valve diseases, cardiosclerosis, arrhythmia blocks, and heart failure. And in some cases, patient has indication to cardiosurgery to prevent decompensation, to prevent embolism in dilated heart chambers, especially atrial fibrillary left atrium formation of intracardiac thrombus and very risk embolism, brain embolism especially, not so frequently. Kidney embolism with acute kidney injury, splenic embolism. Was this specific? No, and non-specific laboratory criteria. What most important? Elevation for reactive protein. In Russian, that's РБ. C-reactive, это connective tissue substance, glycoprotein. Normally in value 0 or very low, maximum 6 microgram per liter. If infection, it can develop in many times, but not specific. When in combination with main criteria, in general blood count, elevation, white blood cells, neutrophils, left shift. What do you say?
Leukocytosis.
What
Leukocytosis.
white blood cells, leukocytosis, VBC. White blood cells count.
Erythrocyte sedimentation rate.
Erythrocyte sedimentation. Globulins fraction maybe. What? No, and laboratory test that support streptococcal past infection. Это что? Elevation antibodies. O and positive culture. Positive throat culture. One beta hemolytic streptococcus. And you can read. We define еще ECG критерия. ECG критерия. Вот, elevation P2 interval longer than 0.21. Это really first degree of atrial block. What if we have 1 or 2 major criteria, плюс fibromyalgia, плюс especially presence of laboratories that support presence of streptococcal infection, we can diagnose acute rheumatic fever. If you have only 1 or 2 major, but no, this test only suspicion maybe. If only minor criteria, laboratory same, only suspicion. And if patient recover, start appropriate treatment, not miss on this stage. Not, то есть antibiotics 1 month. Not only antisteroidal, severe cases with high activity. То есть UCRP, ESR, what you say, same ESR, soil. Elevated in few times, we give additional steroid, prednisolone for example, minimally 1 month. Patient can recover, but need additionally, if chronic disease, treatment not otolaryngologist, and minimum 5 years antibiotic prophylaxis. The penicillin group medication every 1 month, for example, introduce. Or sometimes maybe recurrent acute rheumatic fever. It is sometimes, not frequent.
Doctor, if we have recurrent acute rheumatic fever,
Clinical picture may be same. To diagnose recurrent, we have same criteria. If all proper treatment, no misdiagnosis, no misbeginning treatment in this stage, and antibiotic risk of recurrent fever very, very small, very few persons. And no developing chronic rheumatic disease of heart. But this disease of children and young adults. And especially who in pure social condition, who has no antibiotics proper in first day of tonsillitis. Because tonsillitis chronicus may be not severe, patient can go on lessons, on work, be on cold weather. Other disease that you have, infection endocarditis. What? You understand that in this disease, no direct infection in the heart, in joints. Here antibodies, because antigen, mimicry, antigen. Sometimes maybe direct blood infection, bacteremia, that affect cusp of blood of heart valves. That's infectious endocarditis. This disease develops mainly in patients who had changed endocardium, то есть orthoplasty rheumatic fever, congenital heart valve system, abnormal valves, abnormal intercept, who past heart trauma or infarction, especially subendocardial, intramural, who passed surgery on hearts, including maybe last week I showed you a patient, for example, is pacemaker, who passed invasive catheterization of heart. And usually this age patient, atherosclerosis, changes of endocardium of heart, same predisposed. These young people, infection become more frequent in people more than 40, 45 years old. Usually they have decreased immunity. Maybe diabetes mellitus, chronic pulmonary diseases, heart failure. And usually before bacteremia, they pass for a small surgery, including stomatology, extraction of teeth, for example. Or intravenous injections. Or endoscopy, because it endoscopy, traumatization mucosa, stomach, intestines, or urinary catheterization. In urinary tract, lower urinary tract, in oral cavity, in bowel, very much bacteria. They can pass in circulation. And any bacteria, not only streptococcus, may cause infection endocarditis. Здравствуйте. Работаю в университете даже. Вот infection endocarditis. More frequent effect aorta valve. Aorta valve, restriction of valves, ulcerization. They not closed, can be a result of aorta registration. Patients say have fever, first symptoms, fever, tachycardia. Few weeks, months sometimes. And because of aorta registration, left ventricle heart failure develops, dyspnea, congested in lungs. Very typically, left ventricle dilatation, tachycardia, because blood heart compensate blood regurgitation, but more frequent contract. Result, tachycardia, and diastolic murmur in the water in fifth point, better in vertical position. Heart sounds, semilunar valves, usually decreased. And because very frequent blood feeding and regurgitation, what will be? Systolic pressure elevates, diastolic less 60. Visible carotid arteries. Pulsation, carotid shutter, very typically. And usually, frequently, anemia develops because blood with bacterial toxins in blood, hemolytic anemia develops. Patient pale, but if hemolytic, elevation of bilirubin, free. If European patients, skin may becomes like coffee with milk. Pale brownish. Additionally, particles, thrombi formation, capsule affected mainly aorta valves. Thrombi similar, like, do you know what? Цветная капуста, cabbage flower,
Yes.
white. What? Similar, if patient would die, these pieces strongly infect fast in circulation, maybe brain embolism, maybe very small pass in blood and store. On eyes, hemorrhagic spots and very pain, maybe under soles. Это что? Thrombovasculitis, same, hemorrhagic spots and pain, maybe under the nails, in any part of the skin. Sometimes liver, kidney, spleen embolism with pain injury of kidney, splenic infarction. No, it's because bacteremia, secondary bacterial forced inflammation, pneumonia, for example, meningitis. Patient may die or because heart failure or because acute rheumatic infection. But that's why if we confirm diagnosis, positive bacterial culture, ultrasonography of heart detects failure, aortic valve atmosphere, also premitral tricuspid. Thrombotic vegetation, like flower cabbage, may be visible. This is the patient need in prolonged intravenous antibiotic therapy, plus in severe cases, if complete destruction, very severe transplantation of valves, surgery. One patient may die in few months or years because not controlled ventricular heart failure. What is the infectious endocarditis? You can see in the 2 lecture presentation. What next lecture plan? But who have in second auditorium, lecture in March, no. Second auditorium, reconstruction, and you will see only on the 2. No intellectual party. Yeah? In new instruction, you can read new modified criteria. No, they usually include for infectious bacteremia, positive culture. Ultrasonography confirm valves regurgitation, aortic visible thromboid. Serious disease same. What may develop on the basis chronic rheumatic disease. If patient have no proper treatment, early treatment in this stage. But this disease develop later. In second part of disease, what we have many years before, young female, he had acute rheumatic fever in childhood, like recovered. But in 10, 15 years when she was no near 30 years old, fever develops, left hypochondrial pain, enlarged spleen, acute abdominal syndrome. She first was hospitalized in surgery. But surgeon consult with therapeutic, they see very tachycardia, dyspnea. Therapeutics detect murmur on the aortic valves. The ultrasonography detects aortal regurgitation. Murmur was second and fifth point. Ultrasonography of spleen found splenic infarction, то есть emboli through aorta past arterial greatest sequence past to splenic artery. She passed antibiotic therapy and next was consulted by cardiosurgeon, and it means in few months she passed operation with transplantation artificial aortic valves. Maybe what in reality of a morphine patient 40, 50 and more years old. Well, sometimes infection per blood, if T disintraction or endoscopy. The patient who had very changes of heart passed surgery quite hard was in need in perioperative antibiotic therapy. But this is not very complicated. Maybe oral or injection. Few hours, not late, half hour before some disintraction or surgery or catheterization endoscopy. One dose, for example, amoxicillin clavulanate, wide spectrum antibiotic. Second dose, not later 6 hours after small period. It prevents near complete. Maybe oral, 2 tablets, amoxicillin clavulanate, 675 grams, and 2 tablets after small surgery or injection or perioperative prevention, antibiotic prophylaxis. Now,
The patient
okay, will in some group over 3-4 users, but primary draft variant, you can divide to section, print and show me to see. I correct what is not good. For example, each print will write in English or in Russian individual, maybe same diagnosis, maybe text same, but you will have not same maybe question. Who went, you have individual page. Who missed lesson? No. Or give patient or can join to one of subgroup. Usually students will good and rarely most of students fail practically, very rarely. I remember 1-2 groups who are not ready, only 2-3 students. Dispensary monitor, when she passed irritated, not young, now middle age, and this was in young kid. And broke this near, heart, feeling of heartbeat, pain in heart regions, behind middle inferior step, cough with small sputum. With small sputum maybe sometimes congestion in the lungs. Pneumoragia, periodically bloody cough. Bloody cough maybe not only tuberculosis cancer, maybe a congestion, a pneumonia. Our rheumatism was 20 years before. What's the point? It's sit, force position, sitting. Вот такое будет heart fail, not really. Fail, cyanotic skin. Or down pulmonary sound. Vesicular freezing, decreasing. Moist cells, crackers. Inferior congestion. What? You did 20 increase. No, and when inclination of apical beat was laterally left ventricle enlarged. Where the border placed, same laterally, left inclined. Right border, вот нет пневмона, bridgebone, third, upper border, secondary, то есть one rib, one high, то есть fermentation, not left ventricle, left atrium, VT. First sound weakened, accented, second able, finally with congestion and fine circulation. Вот. Systolic murmur on epics. Which one this is the systolic murmur on epics? Epics for which one?
Micro.
Mitral. If systolic murmur on epics, the first sound decreased, mitral regurgitation. Mitral regurgitation. Perspiration normal. Abdomen, why sensitive, right? Maybe liver disease or vulva, but if decompensation, heart failure, additional congestion in greater and liver congestion, acute decompensation, maybe with down pain. Liver normal size, by quarter of 12, 11, 9. What do you think? It is what's the main disease? Chronic rheumatic heart disease. It is not acute rheumatic heart. With formation. The mitral regurgitation and heart failure. Heart failure. Why not rheumatic fever? You see, leukocyte count, normal segments. 1 and 3, 6 per day. What is normal?
Normal leukocyte peaks.
1 to 9. ECG, 200 per weight. You wait with 200. You drive it. The left atrium vein. You see? I read was the 2 short standard. The level gram. RV5 вот here, more RV4. Left hand epic shift here, that shows the most high R wave in chest is on epics, V4. I have shift here. Left ventricle hypertrophy. And X-ray show enlargement. What? Left quarter, 4 center space. The left ventricle. Center, left atrial molecule. The rotation, left ventricle and atrium. Phonogram. Это digital auscultation. Sensitive. Same to our first decrease on epics. And second sound accented on finally, because if dilatation left atrium, increased pressure and finally circulation. Plus decreasing systolic murmur. Do you know where you can hear murmurs? And change sounds standard. Maybe I sent to you Washington University sample of auscultation sounds. Pain in heart, migrating joint pain, migrating arthritis. Because
Migrating arthritis.
yeah, 1 2 days, 1 pair or 2. Next, this good, but other in 1 2 weeks if you sign. But she suffered repeated rheumatic attacks. She taken ill 20 years old. To here, recurrent acute rheumatic fever. That means she missed proper antibiotics prophylactics. After acute rheumatic, minimum 5 years every month or which medication prolonged or 1 time 3 months intramuscular injection of the penicillin group. And you see, face, skin pale, but acrid cyanoid, blue lips, blue nose, earlobes, chin, lips, tongue. Вот. Crepitation, то есть fine crackles in the inferior part of lung, both lungs. Body so hot and large, to right, 2.5, anomaly 1, то есть right ventricle. And superior border, height, left atrium. Because if mitral stenosis, left ventricle, not good feeling, not enlargement. Then auscultation shows first sound clapping and click discovering mitral valve. But for exams, I check new term, opening snap, sort additional sound, because thick, rigid mitral valve comes open with click after second sound. Вот. Это melody of quail rhythm. Quail это wedding melody of small bird in Belarus, in Russia, Europe. Ну, usually там high pitch, это early rhythm. Right? No, and liver enlarged. Because here not only pulmonary circulation, congestion, that's why cough, breathlessness, crackles symmetrically. And the compensation involves right heart chambers. What is why right border widening and congestion in liver enlargement. Liver H 10 centimeters. То есть recurrent rheumatic fever плюс mitral stenosis and плюс heart failure in greater circulation and in pulmonary left and right heart and ECG shows R short, this bigger than R short, it's a dextrogram because not only and P mitralis, split and P wave, left ventricle. P pulmonale, это high P wave, more than 3 millimeters. Normally P wave very small. What? Remind me next week, I show you, because we conduct valve DC, I show you ECG with P mitralis, P pulmonale. And an auscultation, what? First sound, loud clapping, because thick rigid valves closing. Second, normal and short additional, shortly. Click, opening snap. Right. Ну и pre-systolic murmur. If mitral stenosis, murmur not systolic. Or protodiastolic, beginning diastole when rapid feeling, or pre-systolic with additional blood filling ventricles. It atrium systole. Do you want to hear real quail?
Yes.
Right? I have what? Закладка. How real bird sang. In Belarusian nature. What, for example, husband of Larissa Anatolyevna, Hunter, he had special dog and he not kill. Only see and make video audio. Same similar picture here. What? What? Small bird, like chicken. Which beautiful melody. When the melody. Boy call girl to be my love. And she answers, high pitched. What? Larissa Anatolyevna, same. Has similar melody. next animals don't kill, only go, dog find and stay. Rheumatic disease, 15 years before. Middle-aged female. What to hear? Systolic tremor and palpation. And systolic intensive murmur in second interspace, aorta point and at Watkin point. Here is the best point for which valve?
Aortic.
The aortic stenosis. This is murmur of very difficult time. Normal orifice of semilunar valves, aorta, 2-3 centimeters at opening. If stenosis, it may be sclerotic. On the basis, past rheumatic fever. But infective and the opposite destruction, maybe 2-3 millimeters. Less than 1, you can hear systolic murmur. What? Same sample maybe. What? Shall I show? It's not good finger. What? Aortic stenosis. Тут one variant. First, second sound here decreased. And here, это early aortic stenosis. It's not good finger, you see? And here additionally late aortic stenosis. You see? More expressed. And conduction in carotid artery. But mitral valves in first place in statistic of valves diseases, post-rheumatic. Aorta on second. Pulmonary and trachea, 5% maybe. To understand chronic heart rheumatic disease. Aortal stenosis, heart failure mainly in pulmonary circulation in this case. Maybe what, cough, dyspnea. Why they have syncope, short unconscious, patient stand up? Because it's very difficult time в голове. Systolic pressure not high. And maybe sometimes bad blood supply coronary arteries, they up semilunar valves, and angina pectoris. What, you see, gripping, pressing pain behind sternum. At 5-10 minutes, at physics, it's a secondary angina pectoris. And ECG shows, no, X-ray, I think, clear, left ventricle enlargement, dilatation of stenosis, above stenosis. On level stenosis, it is there, above maybe dilatation. Levogram are first. What this? Larger than seconds. What? RV6 here, larger than RV4, because apex shift to the left. If left, ventricle will appear. Normally, RV4 from chest leads the most high. Because here apex show where body left where apex, most thick pointed myocardium. And here what? Where apical impulse?
Resistant.
Right. Apical impulse fills interspace outside mid-clavicular line. And what if very stenosis, here may be systolic thrill. If very mitral stenosis, here diastolic thrill. So it's called cat's pudding. If you have home cat and very like this cat, what you very gentle stroke and cat thrill. Why he thrill or she thrill? What?
Her
The allergist answer, cat don't like, but because he in love with you, he was very strange. Don't very strong cat, very cat-like. Usually when thrill of animal, it's reaction before aggression. But if your home cat, he терпит. Right? Because in love with what?
And after ST segment below isolated.
If severe hypertrophy, overload, and disorders in repolarization. Or maybe secondary ischemia, same. Because very decreased blood supply of coronary. Coronary artery orifice absent semilunar valves of aorta. Good unit.
Chronic rheumatic heart disease.
Yes.
And
Вот here diastolic experience. And here mitral stenosis, because you see, first sound loud clapping, sound of mitral valve opening or click. In new terms, opening snap.
and hepatic dullness.
Because not only congestion in pylon, maybe because increased pressure in pylon, overload on left, from left to right hand side, and congestion in greater circulation.
Hypertrophy because
Left atrium, hump, P-wave, P-mitral. Это mitral stenosis.
this patient has anemia.
One of the disease, what
Ammonia,
here,
Amazon.
you see, boy, 16 years, suddenly pain in knee joint, swelling, fever, 38. Disease started 3 days after Beijing urea, but 2 weeks before, he had tonsillitis.
Yeah.
То есть acute rheumatic fever with arthritis, rheumatic arthritis. And you see, left body of heart down to the left. То есть myocarditis, you can see. First sound down, mild systolic murmur. То есть systolic murmur, involvement of mitral valve endocarditis. No, and additionally, you see, tonsillitis present, hyperemia, throat, tonsils, lashed, porous, то есть increased, вот, lacuna, with No, and for acute rheumatic, leukocyte count, 12.2. Stop neutrophils, 12%, and up to 6. Segments, 58. ESR, 45. And normally, 10, 15 in girls maximally. We carry, you see, CRP, 40, and normally 0 to 6. Right. Albumin fraction, normally 230 maximally, 26, 28, and 40. Gamma globulins increased. Ну, вот проверь. Acute rheumatic fever, rheumatic arthritis, and carditis, and chronic tonsillitis.
Chronic rheumatic myocarditis.
Good student. Chronic rheumatic heart disease. Which valve problem? Systolic murmur, он ксифоид. Which valve он ксифоид? It's very rare. Ксифоid shows tricuspid regurgitation. No, and heart failure.
Yeah.
Congestion mainly if tricuspid valve. Blood regurgitates through right ventricle. Wind swelling, Liver
veins.
edema, sometimes a side maybe. Right? Heart, ventricle heart failure with congestion and greater circulation. Answer shortly.
It's the same thing. Acute rheumatic
What?
fever.
And this
Same thing.
same acute rheumatic fever, rheumatic
arthritis.
arthritis, rheumatic carditis, and to see what additionally,
See,
what? ECG shows PQ elongation. Это support myocarditis, affection of conduction system of heart, atrioventricular block, first degree. Here no missed heart sounds, and only at X-ray you see PQ, PR longer. Next class we can repeat such task. No, this acute or chronic? Chronic because middle-aged patient. What? Which valve problem? Systolic murmur and xiphoid process. Tricuspid valve regurgitation. And heart failure in greater circulation. Chronic very large liver.
Yeah, liver, also liver failure.
17, 15, 12. Anomaly.
Hepatomegaly.
9, midline 8, in oblique locus 7. То есть twice more. Это maybe formation in chronic heart failure. Fibrosis of liver, so-called cardiac liver cirrhosis. Maybe mild jaundice, aside, elevation liver enzyme, not so severe like true liver cirrhosis. But liver dysfunction maybe. Who have problems? Return task.
Nadia, who was it?
What do you do?